very much, Brian, and good evening to you all. And can I just say how brilliant it is to see you here. I'm sorry it's under such sad circumstances, but if we are going to defeat the proposals that have been made by the Special Administrator, then it's absolutely critical that we as a community stand together in opposition to these proposals. I just want to start by saying thank you to the Save Lewisham Hospital campaign for organising the meeting tonight. The process that we are in, set up by the government in respect of the Special Administrator making recommendations, is a very quick process. It's the first time that this process has ever been used in the whole country, and because it's quick, it feels to me like it's quite ruthless, and I would argue it's probably quite unfair. And so it's really important that we get a campaign off the ground very quickly, because the final decision about all of this will be taken by the Secretary of State for Health at the beginning of February. So a united campaign, a campaign that's quick to get off the ground, is really important. And Save Lewisham Hospital and the campaign group have done a really excellent job. My starting point about these proposals is that I just can't see how downgrading the accident and emergency and potentially getting rid of maternity services at Lewisham Hospital can be in the best interest of Lewisham residents and Lewisham patients. Lewisham has a growing population, and I believe we need a full admitting A&E and a full maternity service. I don't think that the NHS can stay as it is forever. I'm not saying that no changes can be made, but when changes are made, I think it's entirely right that you, the public, know that those changes are being driven by the health needs of people and not by an accountant's bottom line. And so that is why I set up a petition 10 days ago, which said we want to keep a full A&E and a full maternity service here in Lewisham. In 10 days, nearly 9,000 people have signed that petition. So the response has been incredible, but we need to do more if we are going to defeat the proposals that have been put forward. Lewisham's a busy hospital. 115,000 people visit A&E at Lewisham every year. 4,000 babies were given birth to at Lewisham last year, and that number is actually rising. I don't think that everything at Lewisham Hospital is perfect, but I do think that those services are really important for the local community. People say to me that actually services in Lewisham are on the up. The maternity services are getting a better reputation, they've got a good reputation now. We know that more mums are coming from Greenwich to have their babies here. And we also know that if the A&E was to be replaced by this urgent care centre, it would mean that 1 in 4 people who are currently treated here won't be treated here anymore. So I say, where do those 1 in 4 people go? Do they go to Woolwich? Do they go to King's? It's not as if these A&E departments are quiet at the moment. They're busy, they're operating at capacity. And anyone who lives in this part of London knows that getting to these places in the first place is really difficult. I've been to Woolwich Hospital once to visit a family member who was in hospital. I've never been to King's. If something happened to my husband tonight and I had to drive into an A&E, I wouldn't know how to get to Woolwich, and I wouldn't know how to get to King's. So I think that this is a real problem for local people. At the end of the day, Lewisham residents, when you have an accident, when your children are hurt, you should be able to get high quality, effective care quickly and close to home. So for me, that's the bottom line, that the A&E must stay here at Lewisham. The proposals that the administrator have come up with are actually based on the assumption that you can reduce the number of people coming into A&E in the first place. Brian referred to this thing called the community-based health strategy. Now, I'm all up for preventing people from having to come into A&E, preventing people from having to come into hospital, but those sorts of changes are going to take a long time. And I don't think what you can be doing is shutting the A&E before the effects of those changes have actually taken place. Brian's also said that the proposals would result in potentially half half of this Lewisham Hospital site being sold off. You'd have to spend millions of pounds to reconfigure the other buildings so that they could be used for the purposes that have been proposed. And we all know that millions have already been spent on refurbishing our A&E. So that's why I'm struggling to make sense of these proposals that have been made. I also believe that the maternity, a full maternity service at Lewisham should remain. I've already said that we know that 4,000 babies are born here every year. I think that when mums are pregnant, they should be able to go to their local hospital, see a midwife, have their antenatal appointments, and then actually give birth in their local hospital. It's not right that they should come to their antenatal appointments here, see one midwife, and then be asked to go to a hospital or a place where they've never been to before to actually give birth to their baby there. So as Brian said, I think it's absolutely critical that we maintain our maternity services. The link between maternity and A&E is absolutely vital. If something goes wrong when you're giving birth to your baby, you need to know that it can be sorted out there and then. So the link between A&E and maternity is really, really key. And that's why my petition that I set up actually said we need to keep both here at Lewisham Hospital. Now, I would urge all of you to directly respond to the consultation process that is underway at the moment. It runs until the 13th of December. If you go online, you can respond online and say what you think, and I think you need to be clear that you want to see that full A&E and full maternity service saved here. There's also going to be consultation meetings. There's 3 I know that are planned in Lewisham itself. Go along to those meetings and speak up and make your voice heard, because over Christmas the Special Administrator is going to be writing up his final report that he's going to hand in to the Secretary of State for Health in January. So we want to change the recommendations that are in that report. That would be the best thing that we could do if we could get those recommendations changed. If we can't do that, what we have to then do is say to the Secretary of State for Health, you must listen to what people in Lewisham are saying. You must keep the A&E here, and you must keep the maternity services here. Last week I asked David Cameron a question in the House of Commons about Lewisham Hospital. In 2007, he identified Lewisham Hospital as one of 29 hospitals that he would be prepared to have a bare-knuckle fight for. He listed 29 hospitals and he said he wanted to keep a full range of services at those hospitals. Lewisham was one of them. So last week I got up in Prime Minister's Questions and I said to him, which side of this fight are you now on? Because at the moment it seems that Lewisham is paying the price for financial failures elsewhere in the NHS.
Yeah.
Good evening, ladies and